every medication that you take or everything that goes into your mouth, you have to read what it is. You have to read if it's safe for pregnancy. Hi guys, welcome back to my channel. If this is your first time, my name is Precious. Today's video, I'm going to be talking about first trimester to-do list. So these are the things that you need to do in your first trimester. So don't forget that pregnancy is divided into the first, the second, and the third trimester. The first trimester is usually from week 1 to week 12 or week 13, as some people will call it. So from week 1 to week 12, these are the things that you need to tick off your list that you have actually done it or you are doing it. So without further ado, let's get talking. The first thing you want to do as soon as you find out that you're pregnant, this is what I did. The first thing you want to do is to call your GP or call your midwife or register with a midwife wherever you are. Some people, they would say maybe you should stay up to maybe 5-6 weeks before you register with your midwife. That's okay. But in the UK, there's nothing wrong if you call them to say, look, I'm pregnant. It's up to them to decide when your first appointment is going to be done. But at least they have it in the system that you are pregnant. So first thing first, let your doctor know that you are pregnant. Another thing that you have to be doing from now, as soon as you find out that you're pregnant, is every medication that you take or everything that goes into your mouth, you have to read what it is. You have to read if it's safe for pregnancy. Personally, every time I'm taking medication, I always like to read the leaflets to know what I'm expecting, especially the side effects. So in case I start experiencing anything abnormal, I know it might be one of the side effects of that medication. So you want to, first thing first, check everything that is going into your mouth for your own safety and for the safety of your baby. You know now you're not alone. You have a little bunny in your tummy cooking. So you have to absolutely be careful what goes into your mouth because your baby shares everything that you eat. Another thing that you want to do also is to continue taking your multivitamin. My other videos that I've made in terms of trying to conceive, one of the things I mentioned is that you have to take multivitamin, prenatal multivitamin. So while you're pregnant, you don't have to stop, because prenatal multivitamin is not just to prepare your body for pregnancy. It also prepares your body through the pregnancy or helps you through the pregnancy to supply the things that you need for that, especially the first trimester. So it's recommended that you take folic acid for your whole first trimester. So make sure you're taking your folic acid, whichever one you want to take. That's absolutely fine for you, or whichever one that is fine, that you know you are going to religiously take it every day. Please do, because it prevents a lot of things which you don't want your baby to have or yourself to have. So continue taking your multivitamins until the end of your first trimester, especially folic acid. But I know that vitamin D you can take for the whole pregnancy. And if you're taking pregnant care, there are other medication you can take before pregnancy, during pregnancy, and after pregnancy. So multivitamin is very, very important, because you may not be able to eat everything that you need or your baby needs, especially during that first trimester, which I'm going to be making a video about. So you want to take that multivitamin to help you, because first trimester, sometimes you may not be able to eat. Something may not go down your tummy. So taking a multivitamin is going to help you to supplement maybe those things that your body really needs. Another thing you would want to do as well is to cut down on alcohol. I don't take alcohol personally, but I know that some people do take alcohol. So now that you're pregnant, you know that alcohol is not very good for your pregnancy or good for your baby. So you want to cut down on alcohol. That is one thing you need to take off your list during this pregnancy, during your first trimester, or as soon as you find out you're pregnant. In fact, as soon as you start trying for your baby, you need to cut down on alcohol, because it's very, very important. Another thing that you need to also have in mind is that you need to know the signs that you should not ignore while you're pregnant, especially in your first trimester. I'm going to be making a video on the things that you should not ignore when you're pregnant or while you're pregnant. So expect that video. If the video is not popping up on the card, know that I haven't made that video, but I'm going to make the video on the things you should not ignore, or the signs that you should not ignore when you're pregnant. So try and do a lot of research, try and read, join different types of group like baby center group, or different apps that will be showing you or telling you things that you should bear in mind supplement on a daily basis. I think I'm going to be linking up those apps on the description section as well, so you can have those apps on your phone every evening before you go to bed. You go through the app, see what your baby is at, what's going on in your body. Is going to help you. So know the things that whenever you see those signs in your body, you have to straight away go to A&E or straight away go to the assessment antenatal assessment unit. So if you don't know these signs, then I don't know, because obviously you can't tell what's dangerous and what's not dangerous if you don't know what it is. So very, very important, know the signs of the things that you should not ignore in your first trimester or while you're pregnant. One of the things that I will also encourage that should be on your to-do list or it should be on your checklist is that you have to continue with exercises. Let me just say something to you. I know that during first trimester, it's very, very difficult for some people. It's been difficult for me, which I'm going to be sharing. It's the fact that don't stop doing your exercises, especially the yoga, the little things that you can do. Make sure your body is moving. Every time that I do those exercises, I feel mentally okay. I feel really, really good. Even if I still have those symptoms, but at least I feel really, really good in my head and in my body. It's not the rigorous exercise, obviously, but safe pregnancy exercise. You can go on YouTube and search on the exercises that you can do during pregnancy. Go to the ones that are done by professionals, or professionals have actually approved that you can do those exercises before you do them. Another thing that you need to put in your to-do list is that now that you're pregnant, okay, your body is carrying another human being. There are some chores that you do in the house that you may not be able to do anymore. So you have to make up your mind to do the chores that you do safely. Some chores you might decide to stop doing them like entirely now you're pregnant, especially those chores that requires you using like chemicals or washing detergents that are very, very strong. When you use them, that smells really, really strong, you might want to stop using them now. So every of your chore, you want to risk assess every of your chore and see the one that you can continue doing, especially during your first trimester, because you know how delicate it is in your first trimester. That's when the baby is basically forming the vital organs in their body, the brain and every other part of their body that is very, very important for their survival. So first trimester is very, very, very important. So your chores or the chores that you do, you may want to start doing them safely to avoid any mistake, because one thing you don't want to do is to do something that at the end of the day your baby is going to be affected. We don't want that. God has given us this baby. We need to do all we can to keep this baby in our tummy. Please, that's very, very important. So another thing that you may want to do is start doing pelvic floor exercises. For me, is one thing that I have started doing, like from day one. I started doing pelvic floor exercises because personally I have experienced what they call a separated muscle. I think that's what they call it. I have experienced that in all of my pregnancies. So the muscle in my tummy is not as strong as it's supposed to be. So obviously my tummy may not be able to carry the weight. So it's going to affect my back. So I immediately started doing the abdominal exercises to help my core, to help me through the pregnancy, because that's going to help you support your back through the pregnancy. So how are you going to find it? I'm going to be linking some videos on the description section that you might want to watch, because those are the things that I've been doing and I think it's very important. It's going to help you as well during delivery. When you do these pelvic floor exercises, it's going to help you even during delivery. So pelvic floor exercise, you can ask anybody, ask any professional. It's very safe during pregnancy and it's very helpful during pregnancy as well. Another thing that is on your to-do list during your first trimester is that sex has to be done when you feel like it. Tell me about it. Sex was the last thing on my mind because I had a lot I was battling. I had a lot I was going through at that time. What you may want to do is, there's nothing wrong for you to have sex when you feel like having sex. I'm sure your partner is going to understand what you're going through. I'm sure your husband is going to understand what is going on in your body. It's a massive change going on in your body. It's a massive thing going on in your body. You have hormones flying here and there. So sex may not be in the card, but whenever you feel like having sex, do it, because you really have that urge, especially in your first trimester. Another thing you want to put in your to-do list or in your checklist is you have to get your partner involved. One of the things women do is that when they get pregnant, they make it look like, oh, it's my pregnancy, I'm the one who is suffering this, I'm the one who is doing that. Let me tell you something. Our husbands, our partners, they always want to know what's going on. One of the things I've resolved to do in this pregnancy is that if my head is aching me, I'm going to tell my husband my head is aching me. If my leg is paining me, I'm going to tell my husband my leg is paining me. My husband is going to know everything that is going on with me because we are pregnant together. It's not me that I'm carrying the pregnancy, but we are in it together. So I'm getting my husband involved in every single thing that is going on in my body, and I'm getting my husband involved in everything that I want to do. I don't just keep him aside and get him in when I feel like, okay, he needs to get in. So I'm getting him involved in this pregnancy. The whole thing that's going on in this pregnancy, my husband is going to get involved. So I would encourage you, get your partner involved. Don't leave him, because I'm sure most of them want to actually be interested in what is going on. Another thing you want to do is to drink a lot of water. Let me show you something. As soon as I found out that I'm pregnant, I went and I bought this water bottle. So this water bottle tells you from morning to afternoon. This is the morning section. So you have to drink from here to here. Then in the afternoon, you have to drink from here to here. I know that pregnancy makes you wee a lot, but let me tell you the trick that I do. When I go to work, I have my water bottle. I have this water bottle. I'm taking it to work and I'm bringing it back because I use it to measure how much I've drank. My target is to at least drink 3 or 4 of this every day. So because at work I'm not able to take water inside of the lab, so what I do is every time, like every maybe 20 to 30 minutes, I go out, have a drink of water, and when I come back in the evening, before 6 o'clock, I make sure I've finished 1 whole of this water bottle. Then before 7 o'clock, I make sure I finish another of this water bottle. I drink like something is wrong with me. I have my reasons why I'm drinking. So I try as much as I can that before 7, I've finished my target for the day. Then I take this and put by my bedside. The reason is because I try to finish it at 7. So by the time I go to bed around 9, 10, I've weed a lot, as in I've gone to the toilet like 5-6 times and I've weed all the water out, most likely. So I'm not going to be drinking and go to bed straight away, no. So this is why I try to drink early, so that by the time I go to bed, my bladder is almost empty. Then maybe every night when I wake up, or every time I feel like drinking in the night, I take water and I drink. There's so many benefits for you to drink water. So many benefits. One of the benefits is to avoid urinary tract infection. Women are very prone to having UTI, water infection during pregnancy. So one way you can actually avoid this is by drinking a lot, because dehydration can actually cause water infection. So drinking a lot is a good thing. And obviously, water is very good for everyone. So if you imagine you drink 3 of your water bottles a day. Now that you're pregnant, you want to make it 4 because you have someone in your tummy who needs water as well. So I drink a lot, and I will advise you through your first trimester, water is going to help you. One of the things that I did was, because during your first trimester, which I'm also going to be making a video on how to cope with nausea, because tell me about it, is a video on its own. If you can't, because people are going to be saying, oh, I can't drink so much water when I'm pregnant, when I'm in my first trimester, because I have nausea. When I drink water, it makes me sick. Let me tell you something. I did not drink cold water. I was drinking hot water. You won't believe it. When I'm going to work, what I do is I put hot water in this. So by the time I get to work, maybe about 11, 12, the hot water is not like maybe warm. Then in the afternoon, I go to the obviously tea room, get hot water and fill it up again. So I've not been able to drink cold water, because when I drink cold water, I feel really sick. So I've been drinking hot water, or maybe warm water, or however you call it. So look for whatever you can be able to drink. It doesn't have to be hot water. It doesn't have to be cold water. Some people actually put maybe like fruits in their water, or maybe put something that actually changes the taste for them so they can be able to drink it. So just find something that works for you to enable you drink water. So very, very important. So another thing that you want to do, which is very, very important in your first trimester, is you need to start writing down your plans. What do you want to do in this pregnancy? Your shopping list. You need to start making shopping lists. What kind of things you need. You'll be surprised. For someone that has 3 kids, I started showing really, really early, which again, I'm going to be making a video on how to cope with being bloated in pregnancy. So I wasn't planning to start shopping, but because I was growing really big early, I started shopping. So you need to start writing what you need to do. Shopping for you, shopping for the baby. I tell you what, shopping for the baby has a lot. Like, it has a lot, especially if you're a first-time mom. You need to start writing from the first trimester. You need to start writing. The good thing is that most of this app gives you like the things that you need to bear in mind, things that you can start shopping, or things that you need for your baby. So that gives you a clue. And you also need to write down your birth plan. Because one of the things that people don't know is that having a birth plan is very important. Some people have it in mind that they don't want to have epidural. Some people have it in mind they don't want to have pain relief. Some people have it in mind that they are just open. For someone like me, I'm open. For me, the concern or the main thing for me is to have the baby. I'm safe. The baby is safe. However, the baby comes out through vagina, fine. Cesarean section, fine. What matters to me is the baby is healthy. So I have a plan, and that plan is to have an open heart. And I get my husband and my children involved in everything that I'm doing. So I have 1 day or 2 days before I go on maternity for me to do shopping. So start shopping. Don't wait until you have 1 whole day for you to shop. So start shopping little by little, so you'll be able to spread the cost. So these are the things that you have to do in your first trimester. There are a lot of things that you need to do as well, but these are the things that I think is very, very important that you do in your first trimester. If you have anything that you think is very important that you need to do in your first trimester, please let me know in the comment section, because people would want to learn. I would want to learn, because obviously I'm pregnant now, and I want to share this or even make another video from what you've posted that people should do in their first trimester. But for now, thank you so much for watching this video. I hope you've learned something. If you've enjoyed this video, please subscribe to my channel and also turn on the notification bell, so whenever I post videos like this, you're going to get a notification. So thank you so much for watching. Be grateful, be positive, and be yourself. See you on my next video.